I want you to take a look at this foot. What do you think when you see it? Ouch! That's what you think, right? Yeah, that is a bad, painful bunion. And if you have a bunion, you already know the type of pain that's involved. Well, guess what? If you're thinking about correcting your painful bunion, you might be in luck today because there may be a less painful procedure to help you out. I am with Dr. Dr. Chris Suykerbuyk, by the way, of AZ Choice Foot and Ankle, who does a procedure called Lapiplasty. Now, before we talk about this new technology, tell me, why do you get a bunion to begin with?
Well, bunions can oftentimes be genetic. They can also be caused by improper shoe gear or even injury.
Ah, okay. I've heard a few, and dispel some of these myths. Standing on your feet all day will cause a bunion. True, false?
It can make a bunion worse, but may not actually cause it.
Okay, so let's talk about what a bunion is. What's really happening inside of our foot?
Well, what's really happening is a bunion is a progressive deformity where the bone shifts outwards and rotates.
The whole bone?
The whole bone.
Not just here where the bump is?
No, but because it deforms over here, it causes the big toe to come inwards, like being pulled back on a bow and arrow.
Ooh, and that's why they're so painful.
Yes.
I mean, I've got a little one here, and I've had it throb at night, so when you've got a bad one like what we've seen, I can only imagine the level of pain that's involved. Talk about who's a good candidate for Lapiplasty, and what makes it different than any other type of procedure out there?
Well, we have bunions that range from mild to wild and everything in between. Patients for Lapiplasty are anybody who's experiencing bunion pain, anybody who's having difficulty wearing shoes, or if it's keeping them from doing daily activity.
So the old way of doing it was super painful, shaving off a bone, off your foot for extended periods of time. What's different about the new way?
So the biggest difference, in the old way of doing a bunion, we used to shave off the bump, slide the bone over, and put 2 screws with it. That would oftentimes be very painful into the joint. With the Lapiplasty bunionectomy, we actually correct in 3 dimensions. So we derotate the bone, put it back into alignment, and then fixate it with these patented titanium plates.
You used a word that I think is really important for our viewers to understand: correction. You fix the root of the problem instead of trying to put a Band-Aid over the sore spot.
Exactly. If we don't fix it at the root of the problem, at this joint, then bunions can actually come back over time. In the literature, we see about up to 70% of bunions coming back.
This is a fairly new technology, is that right?
It is. They got FDA clearance in 2015, and they've done over 30,000 procedures since.
And I know you've done quite a few yourself, so tell me, what do patients tell you? First of all, we're talking less downtime. Give me kind of the MO on what happens.
So my patients are typically back in a walking boot and able to stand and do their daily activities within 2 weeks of surgery. They're back into an athletic shoe at around 6 weeks and back to normal activities around 4 to 6 months depending.
Okay, that's huge in comparison to the old way. All right, let's talk about quality of life. What do your patients tell you after they've healed and they're back to normal?
My patients love how their foot looks afterwards. Many times they had difficulty finding shoes that fit them, or they were embarrassed about the bunion, self-conscious. My patients get back to wearing shoes that they want to wear, wearing sandals without feeling self-conscious about that bump on the side of their foot. They also have less pain often, and they're able to return to activities like running, hiking, and walking.
Excellent. All right. Well, thank you so much for the information, Dr. Suykerbuyk. We appreciate you for that. For more information about the Lapiplasty procedure, visit fixmytoe.com. And to learn more about Dr. Suykerbuyk, visit AZ Choice Foot and Ankle in Gilbert or call 480-632-5757 or visit the website azchoicefa.com.